SNAP, prior to receiving it, when I was working more than one job and my son had a lot of extra medical expenses, I was just above the threshold for eligibility. And that was a very difficult time. And I was working, but I was thinking about food all the time, and I was hungry. And I was definitely not as healthy during that time. There was a point where I was looking at my pantry. I was sitting on the kitchen floor, and I was already eating less at meals or sometimes skipping meals. And I looked at my pantry, it's pretty barren. And I had this realization that I could go hungry, but I couldn't do that to my children. I had avoided and put aside applying for SNAP and not wanting to do it, and having gone through the process before several years prior, where you had to fill out a 26-page application and they ask every possible private financial question that you can imagine, that felt very invasive and very dehumanizing. All of those things, the stigma, I didn't want to go through that process again. But when that hit me, when I realized that I can't let my children go hungry, I realized I had to apply. The process itself is very difficult. And I have 2 degrees, so this was kind of one of the last situations I imagined I would end up in. It allowed me to not have that stress at the grocery store. So I wasn't choosing between, do I buy toilet paper or do I buy lunch meat? Do I buy milk or do I buy more pasta? So SNAP, what it did is it just lifted this huge weight and this burden off of my shoulders. And all of a sudden, things that previously I had not been able to purchase, I could. I know that my health improved and I was suddenly not thinking about food all the time. So there's a ripple effect. When you receive SNAP, it makes it possible for you to eat better, it improves your health, it gives you focus and mental clarity, it frees up money to pay for all the other necessities in your life, whether that's rent or housing or your heat or your gas. This is not a work issue. This is a life and health issue. This is a time, energy, and money issue. And for those of us who are receiving it, it really comes down to being able to feed our families and make sure that they can survive and live. And if our children aren't healthy, that affects our ability to work as parents, and it affects the entire families. Without that in place, you will have more families who are experiencing more health issues. You'll have more families that will be going to the hospital or going to the ER, or whose families are unable to work. What would you do if all of a sudden your child or your spouse or your partner or your loved one suddenly had a major health issue and you didn't have the ability to pay for all of their expenses out of pocket, and you suddenly needed to care for them and take them to all their medical appointments, and you didn't have a support network? Would you say that it was wrong to have a little bit of assistance to ensure that you and your family are doing okay and you can eat?